Hello, welcome to the lecturer's desk. Get your medical thoughts cleared before you leave. And please don't forget to subscribe to the YouTube channel and turn on the notification bell.
Hello guys, welcome back to my YouTube channel once again. My name is Michael, can call me Mike. Please, if you are new here, kindly subscribe to the channel and turn on the notification bell. If you are old here too, please get yourself a desk and let's get started. Today we are going to talk about electrocardiography, which is the graphical representation of the activity of the heart. We've already talked about how the heart generates its electrical activity and then electrical impulse and transmit it throughout the entire heart. So today we are going to talk about how we can put this activity in the heart in a graph form so that we can read. Now, but before that, let's go through some basic things over here so that when you get started, you can understand it very well. Please bet me you will understand each and everything that I'm going to talk today. It is so simple. So follow me. Please, if you take the graphical representation of the electrical activity, which is the EKG, we have positive and negative waves. So let's assume this is our 0 degree. From here downwards, here upward, this is the positive, this is the negative. So any wave below the negative or below the isoelectric line is what we record as a negative, and anything upwards is the positive. Now, if you take the heart, let me take some part of the heart, a tissue of the heart, and put it over here or magnify it over here. Okay, the electrical activity generator is going to move throughout the heart. Do you understand? So when I take a tissue, this tissue is actually representing the heart. Now, the device that you are going to record, this one, they are the electrodes. Do you understand? So we put two electrodes, positive and negative, across this tissue. Now, when you put a positive and negative across this tissue, you generate the electrical impulse with the action potential and then transmit it. So the transmission of this electrical impulse is actually the excitatory ions that will be moving from one cell to another, get it activated, then get to another cell, get it activated. So the movement of the electrical impulse is actually the movement of the positive ions towards various or series of cells and get them excited, and this is how we transmit the electrical impulse. So here, this transmission of the electrical impulse, I'm going to represent it with a vector, and because it's being done by excitatory positive ions, I'll represent this by a positive vector. And we know when there's a movement, let me use this one. When there's a movement of a vector, actually a positive vector, towards a positive electrode, we record it as a positive wave. Are you with me? If there's a movement of a positive vector away from a positive electrode and get closer to a negative electrode, we record it as a negative wave. Now, we have a straight line over here. We can see it over here too. This is what we call isoelectric line. The isoelectric line happens in two main ways. One, when there's no electrical activity or there's no movement of the vector, we record that one as an isoelectric line. And two, when there's vector, by the vector that we generated is actually moving perpendicular to the electrode. So this is our electrode. Let's draw an imaginary line over here. You see that this vector is moving perpendicular to that one. Do you understand? And because of that, we record it as an isoelectric line. We get both positive and negative reading, and this positive and negative reading cancelled out, giving us a straight line, which is the isoelectric line. Now, this is when there's excitation, and we know the excitation, which is the depolarization, is by positive ion getting into the cell to depolarize the cell. Now, in condition where you want the cell back to its resting membrane potential, what happens is we open the channels that causes what? The movement of positive ion away from the heart, and then the influx or the movement of negative ions inside the cell. So this repolarization, the positive ions are going outside, and then we get what? A negative ion inside the cell. So as we get a negative ion inside the cell, that's what depolarizing the cell, the vector becomes what? A negative vector. It's not a positive again. The positive for what? Depolarization. The negative is what? For the repolarizing. Get a negative vector. And when a negative vector moves towards a negative electrode, so negative, we get what? A positive what? Reading, which is a positive wave. And then when it is moving towards a positive electrode, we get what? A negative reading. So it's actually opposite to what I just said. Now, we have this. We have actually 12 leads that we use in what? The reading of the electrical activity. So these 12 leads, we have 6 that are for the limbs. That the upper and the what? The superior and then the inferior limbs. And then we have 6 that are for the chest. So for the 6 that are for the limbs, we have 3 that are bipolar, and we have 3 that are what? Unipolar. Okay, now we will talk about. I'll take each and every lead here and its graphical representation. It's not in this video, but the previous and the coming video, that's how we are talking about. So today we are going to take one common lead and then use it to interpret what actually this what means. Do you understand? Now let's take a common lead, which is what? The lead 2. The lead 2, the electrode are placed in such a way that the negative is at the right hand and then the positive is at the left leg. So if you take the heart, the right hand is closer to the what? The base of the heart. So the negative is closer to the base. And then the left leg, the positive is closer to the apex. So the positive is over here. Now, let's go. We generate the action potential from where? From the sinus node. So when you generate the action potential from the sinus node, it would what? Transmitted throughout the entire heart atria. So as the entire atria get depolarized, the movement, where is the movement? We generate it over here. Where is the movement? The movement is what? Downwards. You understand? So all the various, we have various movements of the electrical impulse, but we have one common vector, or one common vector among all the vectors that will be generated. You understand? And this one common vector that you will be having will be moving towards what? The apex of the heart. And as it moves towards the apex of the heart, what electrode is over there? We have a positive electrode. And remember, as I said, when there's a positive vector moving towards a positive electrode, we read it as a positive wave. So this is actually what? The positive wave of what? Our reading, representing what? The depolarization of what? Of the atria. So this is right, and then the left atria, when they depolarize, is being represented by what? The P wave. Now, after that, the electrical current need to pass through the AV node and then get to the what? To the ventricle. But we all know that the AV node delays what? The transmission. And this delay of the transmission causes no movement of the electrical impulse, or this slow movement of the electrical impulse. And because of that, we cannot what? Know that we can't detect the direction of the vector, because it needs to get itself depolarized first before it can transmit it, and it is delaying over there, and we cannot determine what the direction of the vector. And because of that, we get that reading as an isoelectric line over here. So this is the isoelectric line that we have for the delayer. Now, after the AV node gets the electrical impulse, it transmits it through the AV bundle, and then you get what? The right and the left AV bundle. Now, if you come to the right and then the left AV bundle, they depolarize the septum wall of the ventricle. Do you understand? The septum wall of the ventricle. We have the left and the right. If you take the two, the left do 90% of the work. You understand? So the left, let's assume this is the left, and the left will be what? Performing the 90% of this work. So what will happen? What will happen is, if the left is performing 90% of this work, 90, there will be what? Movement of the positive ions into what? The cells in this way. Do you understand? Yeah. To get this what? Depolarized. As we are moving this one, we get what? The vector. The vector is moving towards this area. Do you understand? Let me do a big vector here. So this vector represents all the small vectors over here. This vector is representing the movement over here. Do you understand? And this movement over here, you see, is it moving closer to the positive electrode or away from the positive electrode? It is moving away. If you are moving this way, if you are here, you are close. If you are moving this way, get what? Away. Do you understand? So it is actually moving away from the positive electrode and getting closer to the what? Negative electrode. Do you understand? And because of that, we record this what? A negative what? Wave over here. So this wave is what we call what? The Q wave over here. So this is what? The actually depolarization of what? The septum wall of the ventricle. And sometimes this doesn't what? Appear. When it doesn't appear, that means this vector move perpendicular to the electrode, and because of that we couldn't what? Read it. Do you understand? As a positive or negative. So it gives us what? An isoelectric line over there. Do you understand? So when it's move perpendicular what? To the electrode, we don't record it as a negative. But when the direction what? Gets closer to it, record it as negative. So now let's come from there. There's what? The current gets to the ventricular wall itself. You see, from the endocardium to the muscle itself to the what? To the epicardium, they get what? Depolarized. And this depolarization, do you understand? It's towards what? The positive. So this gives what? A large or positive vector, because this muscle is very huge. Do you understand? That is the left side. Depolarized. So this gives us what? This big wave over here, which is what? The R. Now, after that, you see, this part, they are also ventricle. They need to get themselves what? Depolarized also. So what will happen is the what? Movement of the vector to this place. And as the vector moves to this place, is it getting away from the positive? Yeah. And it's getting closer to the negative. So away from positive, closer to the negative, give us a negative what? Wave. So this gives us what? This is negative what? Wave over here. So here all the ventricles get what? Depolarized. And as all the ventricles get depolarized, it takes about small time for it to get back to its normal state. That's the resting membrane what? Potential. And this small time, there won't be any reading, electrical reading. So this gives us what? The what? Isoelectric line over here. Over here. Now, after that, we need to what? Repolarize the ventricle. Do you understand? So as you are repolarizing the ventricle, we need to what? Move what? The positive ion from what? From the cells, and then we get what? More negative inside the cell to repolarize it, to bring it to its what? Resting membrane potential. And because of that, as negative ion get in, negative ion get in, what happens? We form a negative vector. And as the negative vector what? Start what? Depolarizing what? The ventricle, the movement of the vector becomes this way. The movement of the vector becomes this way, and this vector is negative. And as negative is moving away from positive towards the negative what? Electrode. Do you understand? So what will happen? We get what? A positive what? Wave over here, and this form what? A positive wave. So this is actually This wave, the upwards and then the positive, the negative waves over here represent the activity of the heart. Now, if you take this wave, this P wave, let me make this come on over here. So for the waves, we have P wave, which represents the atrial depolarization. We have QRS complex, and then we have the T wave. Okay, so we have R3. We have interval. Let me put segment first. Segment. The segment is actually between one wave and another. The space in there is what we call the segment. So this wave and then this wave, that is the QRS complex, what we call the segment. So this is actually our PR segment. Do you understand? If we have the S and then the T, we have another segment. This is the ST segment. Now, let's talk of the interval. The interval is both wave plus segment. So, for example, I have my P wave plus my PR segment, CR segment. So I'll actually get PR interval. PR interval. And then I have my Q and my T. I actually get the QT interval. When I have this to be my wave and this to be my segment, my wave. Okay, so it's okay. Now there's last thing that you need to know. This segment PR is very important. So this segment gives us an idea in diagnosing patients that have AV node blockage. Okay, the AV node blockage. It gives us idea of how the blockage is, whether it's a first degree, second degree, or third degree of the blockage. It's actually the time taken for the electrical impulse to be transmitted from the atria to the ventricle. So this is basically what we have to know about the reading on the graph of the EKG. So if you have anything to ask, any comments, you can pass it on throughout the comment section. Do you understand? So that if you have a personal doubt, I can clear it over there for you. And if you find this video also interesting, please kindly subscribe to the channel and then put on the notification bell. Support me so that I can bring more videos useful for us all.